I'd like to extend a warm welcome to you all to our webinar, Doctor, Gimme the News. Before we start, however, I'd just like to confirm that everyone can hear us. So perhaps if you can, you don't all have to do it, I don't think, but if you can all just enter yes, so that we can confirm that we do have audio live. Thank you. We can all hear?
Yep, so to confirm, if you can hear us, just type yes in the questions box or the chat box, just to ensure that you can all hear our audio.
Excellent. I think we have audio. Just a thought for you all. If you have questions, please just make a little note of them. At the end of the webinar, we will provide an email address, and we will look at all of your questions and provide an answer for you. So we'll look at our learning objectives today. We have 30 minutes, so we want to be timely. Looking at the role of the GP in managing workplace injury and the return to work process, trying to explore what doctors might face in managing return to work, including any concerns or reluctance they might have to certify their patient with a capacity for work, and then giving thought to, as a return to work coordinator, how, or can I, and in fact, how can I influence a doctor's engagement in the return to work process? We are joined today in conversation with Dr. Chris, who is going to hopefully give his expertise and advice in helping us answer some of our questions about doctors and the return to work process. So if we give thought to working with doctors, we know that we all have relationships, and doctors are no different. Doctors have a relationship with their patients, they will have relationships with the specialists they use and allied health providers, but recognize that doctors, their primary interest is in the care of their patients, and they may have some uncertainty of what their role is in the return to work process. They may have no experience managing a work-related injury or an illness. Their past experiences in this process may impact on whether or not they wish to be engaged with return to work coordinators and the return to work process. And some doctors do find the requirements of the return to work process somewhat daunting. So Dr. Chris is going to give us some thoughts around his experience with his role as a doctor, looking at his approach to managing patients that come into his practice who have had a work-related injury or illness.
Well, thank you very much, Elaine, and good afternoon, everyone online today. I think, firstly, one of the things that Elaine mentioned was that some doctors are actually uncertain of their role in the whole return to work process. A lot of research has been done just to try and clarify this thinking, and some of the things that are coming out is that over the last 10 years, there had a lot of migration of doctors to this country. And what's actually happened is that they've come from countries with very different legislative requirements for managing work-related injuries. And their training and support hasn't necessarily been the same as other doctors in the system. So legislation changes all the time. How do we keep up with what's going on when it comes to impacting on our ability to understand the system that injured workers are in. So the role of the doctor, role of the GP is the first port of call when a worker is injured. Yeah, certainly it might be in an emergency department, but more often than not, it is the GP. And so really, when a worker comes in, we're going to be taking a history, an examination. We need to think about whether investigations are required to make a diagnosis, because really a diagnosis is fundamental to a claim progressing. The other things that a doctor will do is to actually think through what are the goals of treatment and to work with the patient to actually get there. And then filling out the lovely certificates. So the work capacity certificates, which ReturnToWorkSA now has, have provided a few dilemmas for some doctors because they have changed a number of times over the last 5 years. And so we're trying to help doctors understand what these changes mean. So that's another little gap in some doctors' knowledge in what the new certificates look like, how they're used, and how they are filled out for the best outcomes for our patients. So we're also looking at helping doctors understand the medical restrictions. So when they examine a patient, come with a diagnosis and think about, is this person able to work or not? They need to think about the worker's capacity to do some sort of work. And they need to think about what restrictions there might be on this person going back into a workplace safely so that they can actually make recovery on a gradual progress. But this is more complex than we all imagine. And I'm sure all of you out there as return to work coordinators have had some experiences of working with doctors and especially working with your injured workers. Some of you are going to have great experience of lots of people. Some of you may have only ever had to work with one or not even one worker. So these things are a bit like GPs. We may only have one person a month that we may see with a work-related injury. Some people are seeing multiple per day. So clearly GP's experience in working with injured workers and the system of return to work is going to vary hugely. And one of the really important parts is understanding the evidence behind what needs to happen. And so this is something that's relatively new over the last few years, where doctors are being taught that activity is actually really, really important for good recovery. In days gone by, often a person would present with a painful condition, let's say a lower back pain. They would be given some strong painkillers, told to go home and rest, that you can't do much at all. So that's something that we've got to change people's attitudes towards. And really, we're now knowing the evidence about what aids recovery. It's actually not lying down and doing nothing. It's actually recognising what is going on, clear explanation of what the injury is, that recovery is the most likely outcome here, and a graded exercise program to improve recovery. So this is all now evidence-based. And the critical part is that there are health benefits of work. And this is an area of evidence which has now come to light over the last 5 years. So that going into the workplace where you have a social network, you've got friends, you've got supports, you've got something you're comfortable doing, you've got mental stimulation, these have been shown to be benefits for recovery. And even though people may have injuries, they have a capacity to do some type of work. And when they're doing some type of work in a supported network of people that understand who they are and what they're about, then recovery is quicker and the outcomes are far more sustainable. So these are things that we're working with doctors to help better understand, and we'd like to help return to work advisors also to actually understand the dilemmas that GPs face in having the right approaches to getting people back to work.
It is well known, isn't it, Dr. Chris, that long periods of incapacity result in deconditioning. That means that potentially, once they try and be active, there may likely be less tolerance of activity. And that applies with work, doesn't it? If you can lose work fitness just as you can lose match fitness very quickly.
Absolutely, and I love that term, match fit, that, you know, are we fit for work? And this concept of deconditioning is where our muscles actually lose some tone, we lose some actual muscle strength. And in everyday activity, if we're sitting around at the table or in our beds all the time, we are losing our ability to do things. So it's no different for work. And so getting people doing things at work, even if it's getting, you know, on the bus, going to work, walking to the workplace, and doing some basic activities, that will help people improve their muscle strength, their mobility, rather than just lying around or sitting around not doing very much. You'd
almost consider work as therapy, wouldn't you? The right work?
The right work in the right supportive environment is actually a real positive. Now, of course, on the flip side, if you've got work that's not actually matched for the person's capacity and function, you've got a negative workplace, you've got people that actually take a dim view of work-related injury, say negative things, that's all actually creating a toxic culture about an injured worker. And they all actually are negatives when it comes to thinking about outcomes for work. So that worker, so it's really an important aspect for return to work coordinators to provide a supportive workplace for an injured worker.
Excellent. I know I've met many return to work coordinators in my time, and many of them will comment, oh, the doctor doesn't return my call. I can't get through to the doctor. So I want you to share with our coordinators a day in the life of a GP.
Yeah, well, thanks, Elaine. Look, the day in the life of a GP is certainly complex. When we look at the last decade, actually, it's become even more complex when we look at who's coming to see us, the ageing of our population, lots of people with chronic conditions. It means that it takes longer to see many people. We've got lots of people, and as you see on the slide, some people are seeing up to 60 or 70 patients a day, taking lots of phone calls, writing prescriptions, reading letters, lots of referrals. I mean, we've got to take a lot of information in from hospitals, specialists, allied health professionals, and we really need to be on top of all of this when we're seeing our patients. And then we get one injured worker, maybe in that group, maybe once a week. And we've got to then say, well, where are we going to find time to actually ring a return to work coordinator? Where are we going to have time to actually meet a return to work coordinator? How do we do this? So you can see that it's actually a very busy time, and GPs are under a lot of pressure to see people because they don't want to keep people waiting, and they've got a huge demand on their days in the practice. So we need to think about when we try and work with a GP from a return to work coordinator's perspective, there is limited time in that day, and we need to make sure that the messages that you have, if you want to talk to that doctor, are clear and that you really do need to actually interact with that doctor. So I think what we need to do is understand that doctors are in a very busy situation, and it's not to minimise the fact that a work injury is actually important, but it's actually how are we going to go about it? How do we interact with that busy health professional so that a return to work coordinator gets what they need, the GP and the patient are actually doing what they need to be doing in a time-efficient manner. So I think that's some of the take-homes we're going to have to look through today to help everyone work this through, because it's a team game, the injured worker. This is not just the doctor doing his or her stuff. It's not about the employer doing their stuff or the worker. You know, we need to all get this right to have successful outcomes. So we're going to talk about how to get this team game right.
Yeah, so it is about partnering with the GP and their employee, recognizing that the doctors don't have unlimited time. If you place a call and the doctor returns your call and you're not available, is the doctor going to keep you on a list and say, I'll call them back later? So the benefits to a coordinator, you know, using the gatekeeper, the practice manager, to identify when it's best to talk to a doctor.
Exactly, and I think, look, you know, you'll see on the slide up there, it says that the doctors, there are quite a few doctors who have very little experience managing workers with work-related injuries. So let's make it easy for everyone. And so a return to work coordinator could actually make contact with the practice manager, say, what's the best way of making contact with Dr. Chris? We've got Elaine, who's our injured worker. We'd love to actually have an interaction. Does Dr. Chris prefer an email, a fax, or a booked time for a phone call? Or, can I come in and can we make a time for a case conference? So some of that planning can be helpful. I think one of the things for working with doctors that haven't had a lot of experience is actually sending a fax with a list of questions, your name, your address, your phone number and email, and what you want to know as a return to work coordinator that can help the doctor and help the patient for a successful outcome.
The other thing often is that a coordinator thinks, I'll just rock up at the doctor's rooms with the patient and hope that the doctor will see me. The importance of, if you're going to partner, you've got to demonstrate some respect for the doctor and his or her patient, and avoid putting the doctor in a difficult position by just rocking up and hoping the doctor will see you.
Yep. Now, I think that's a really important thing because, for some doctors, having that third party in, wanting to come to the room can be very confronting, and that goes against a lot of what their normal consultations are. So if return to work coordinators seem a little bit surprised the doctor is not embracing them to come in, it'll be because their patient's welfare comes first. And so the doctor-patient interaction needs to be actually remembered by return to work coordinators. That's the first part that needs to occur. So the doctor-patient consultation is actually a private thing. And so a return to work coordinator can get a signed consent to be involved, to be releasing information. That's important, but it still doesn't give them a passport to enter into the consultation, and that needs to be remembered. So it's better to say, look, planning a visit, say I'm coming with the worker. If we can make a longer appointment, then you have your consultation with the worker, and then if I could have 5 or 10 minutes of your time just to explain the role of the worker, the job that we have available, the duties, the opportunities to actually help the worker get back to work. Then if that came in a fax before the consultation, I would be delighted because I would be clear on why the return to work coordinator is coming. And I would also be clear on what information I would be needing to pass on to the return to work coordinator. And really importantly, I've had the consent to actually speak to you, because that's a really important aspect, that if the worker hasn't signed a form, then I'm not sure who you are and whether I'm allowed to talk to you about what potentially is quite confidential information.
Absolutely. And all coordinators would be aware that a signed authority from the worker should be something that they seek initially, and then make sure that the doctor has a copy of that on the record for future reference.
Exactly. I think the other thing that's going to be important too is that when you think about an injured worker, that worker's come along, they might be in some pain, they might be really uncertain about their own situation. So they might be feeling anxious, and anxiety creates a whole lot of dilemmas with pain and how we function. So let's say the doctor's having a very busy day, up to patient 50 of his 60 plan.
Probably not had lunch.
Hasn't had lunch. Has an injured worker on the schedule. Has to fill in a whole lot of forms, which may make them a bit more grumpy. And then you've got a demanding return to work coordinator sticking their head in as well. So your doctor's probably in not their most creative frame of mind, feeling a bit reactive, and a reactive patient, because of course that anxious patient's feeling a bit on edge. And we've got a demanding return to work coordinator. This is a recipe for disaster. Everything's not going to go well. So that's why planning and taking a proactive, relaxed approach is going to be really important here.
And that's why sometimes a doctor may have had these experiences, Dr. Chris, and say, I don't want them coming along, or I don't want to engage with that role of return to work coordinator, not because you might be inefficient or insensitive. It simply is my past experience says I don't think I want that return to work coordinator function involved in my relationship with my patient.
That's right. My little brain's going, beware. My past experience. Here I am. I'm running late already.
Yeah.
Look, I'm feeling very unhappy at this point in time.
So, if you want to get a Guernsey to play on the team, this is an excellent approach, isn't it?
Yeah. Look, basically, doctors get up in the morning because we want to do our best for our patients. We're here to help people, and that's really what this whole process is. Sometimes we look at work-related injury and the whole system that it is. Sometimes, doctors think, well, it doesn't necessarily do the right thing for some patients. But if we actually focus on all the team, and that's the return to work coordinator being involved in a way of thinking, we are here for the patient's well-being, then you're going to be on the same page as the doctor. If you're trying to do things which maybe look as though they're going to be negative for the patient, the doctor's going to take a pretty dim view of that. So we need to actually be sitting down, talking and discussing this. And with a focus on how can we get the best outcome here for our patient. And I think it's really important too, because the motivations of a doctor are to help that person. But sometimes a workplace, an employer's motivation may be different. They're clearly there for profit. They want to be productive, and they see an injured worker sometimes as a negative. So people come up with different agendas. But if we focus on, look, the agenda needs to be, we're here for the patient's well-being. We know that the evidence is actually getting people back to work in some capacity early is going to be good for the worker. That's going to be good for the workplace as well.
Absolutely. So you have to look as a coordinator about thinking, what's the common ground that I have with the doctor?
Yeah. So the common ground, that's important, but also how can we reduce the friction for the doctor and the coordinator and the patient? And we think about those terms, then we'll be going to improve our working relationship with that doctor.
So let's think, as a coordinator, do I want a effective working relationship with a doctor who's managing my employees' workplace injury and return to work? I guess most people would say, yes, I do. And I want to play on the team. So we've got a few thoughts, and I don't know, we haven't spoken, Dr. Chris, about making sure that, well, could the coordinator provide some information about the workplace? What does the workplace do? What does the worker do?
Yeah.
So that you feel I'm in a better position to understand what might be, options and ideas to support capacity rather than go the fallback position of incapacity because I don't really know. When my patient says, Dr. Chris, there are no light duties in my workplace.
Yeah, no, I think it's important because one of the things that, in a busy general practice, I'm not going to be aware of every industry and every employer's situation, let alone the role that worker plays in that workplace. So if a return to work coordinator was able to bring pictures, a description of the actual role that the worker currently has, and a description of opportunities or other activities in the workplace written down, then that's going to be probably one of the best ways of actually helping me because, seeing things, as we know, the picture tells more than 1,000
words. Yes, absolutely. Photos are good.
Exactly. Now, if a return to work coordinator comes along and just tells me stuff with no documentation, that makes my job even harder. And so it's actually be armed with information. So in your workplace, have a portfolio. Ensure you've got job and person descriptions, photos of the activities or the workplaces. So you could take a little video and bring that along. Exactly. And look, I've seen that being done before. I've seen that some employers actually have a website which actually just shows where activities are in their workplace. And then they allow doctors to log on to that particular website. Excellent, excellent.
So thinking about all of those things, what reassures you, Dr. Chris, when we look at a return to work coordinator?
What reassures me? Well, I think the thing is someone that's optimistic, that the return to work coordinator is clear that they are here to help the worker. Okay, so I think that's paramount. They come in with a positive attitude that how can I help the worker? How can I help the doctor find ensure that the activities are available and that the doctor is actually able to have any questions answered easily, because that open-minded, that supportive manner is going to help everyone. Now, as I said, if you're actually a doctor that doesn't see a lot of injured workers, or you've actually maybe not a doctor trained in Australia, you're unclear on roles, unclear on this certification for capacity, which we are now talking about with health benefits at work, then from a return to work coordinator, that's supporting that doctor to say, hey, look, we've got these activities, and what more do you want to know, doctor? What can we help you with? Is a really sort of clarifying statement.
Yeah. So our return to work coordinators could reassure you, Dr. Chris, that we will comply with your restrictions, because that's a lot of anxiety for doctors. Is when I certify, will that then be applied in the workplace? Will they be supported? Will they be monitored? Will the restrictions be followed, so that I have a confidence that a return to work is actually not going to be counterproductive to my patient's ongoing journey of recovery and return to work?
Very important, because that whole concept of confidence and optimism, we look at that from a brain chemistry perspective. I don't want to get too technical here, everyone, but certainly reducing uncertainty means we reduce anxiety and we reduce adrenaline in our brain. That if our brain is exposed to too much adrenaline via this uncertainty and fear, then that actually increases pain and reduces the length, increases the length of time for recovery. So, if I have a confident return to work coordinator who's optimistic, I can transfer that optimism to my patient to say, Elaine, it appears you have a supportive workplace. It appears that they are actually wanting to do the right thing. That fills me with confidence. So my confidence in helping my patient break down their fear and thinking that they will be able to get back to their work is incredibly important. And all the evidence actually supports this. So the return to work coordinator has a really important role to be in this optimistic, supportive area.
The things that you don't want them to do, if you were to give them a few tips from your experience.
Well, clearly, if some of those things on the screen occur, then I'm going to be having a bad day. If I'm having a bad day, my little reactive reptilian brain will be at its foremost, and that doesn't help convey good, positive messages to my patient. So if you're a demanding return to work coordinator trying to tell me how to do my job, then I'm going to probably feel a little uncomfortable, and I'm going to wonder about, is my patient actually going back into a safe place? And it will start making me question what's the real agenda here. And so that uncertainty about the agenda, remember what I said before, Elaine, about uncertainty, fear, adrenaline, it all goes around. And so the return to work coordinators need to take some responsibility for how they approach things. And especially don't come in comparing cases, because, we all know people go, oh, they get better. In 2 days they were better, the same injury. Now, every person is different. Every one of us is unique and special, and all the circumstances that surround us will have an impact. It's about the whole person.
Yes.
And so holistic personal approaches are really, really important. And that's the secret to success with return to work, is making sure everyone is unique, and what we do to support people takes into account all their needs.
And avoid questioning if somebody doesn't recover in an expected time frame, questioning their motivation. Are they sincere? Are they embellishing their symptoms? Do they have another agenda that isn't recovery and return to work?
Exactly. And I think that, when we start seeing people that, are struggling to get back to work, and as a GP, I always ask, what else is really going on here?
Yeah.
And so one looks at what's happening in the workplace, what else is happening in the person's life, what messages are the workplace giving the worker? Because if there's fear involved, and uncertainty about future employment, uncertainty about their ability to get back to work, then all that plays on the person's mind, and that actually adds to this negativity, which I was mentioning before, can delay successful returns to work.
So in thinking about what are the take-homes from today, get the Guernsey, play on the team, instill confidence, Dr. Chris, that I'm trustworthy. I am, capable of demonstrating those behaviors that give you confidence to say, my patient will be safe when I support them to return to work and graduate back to work. I think understanding the doctor's perspective, because it's not easy, you've got busy schedules, juggling balls, we're all unique, so we all recover in different time frames and have different complexities. Be an advocate for supporting the recovery and return to work process as a coordinator. Because if you are, you'll balance the needs of the employee, the needs of the workplace, the needs of the doctor, to get an experience that is positive for all parties. We do recognize the health benefits of work, but we need a safe environment. So the other important thing for coordinators is demonstrate respect for the certifying doctor to support the medical restrictions. Don't say, I don't have it, so you'll have to do something else today.
Oh. So I think that's really important. Those 4 takeaways are particularly important. And I just wanted to add a 5th one, which is not on the screen, but just to reiterate about planning your interaction with the doctor, so that you've actually got a channel of communication that you've made with, say, the practice manager. Your details are documented. You've got a business card. You've got a document which talks about the worker and what you're there to do, so everyone's clear. And that if I need to, as a doctor, make contact with you, then all of your contact details are there. I don't have to go flicking through Google to find your details and think, who am I actually working with? So make it easy, reduce the friction, think about communication is key to success here.
And what we talked about right at the beginning was relationships. We all have them, we all value them. Why should our relationship with a doctor and his or her patient and our employee be any different?
Exactly, Elaine. And so really, good relationships, good communication are fundamental to good outcomes for our injured workers.
Thank you, Dr. Chris. Hopefully we've given you a few things to put in your toolkit. We do certainly ask you to forward your questions to the coordinator at ReturnToWorkSA.com. That's our inbox, and we will look to answer your questions and provide a response. The webinar will be on our website. We can't define the time frame for that here today, but could I say it'll be imminent. So if you want to go back and listen and have another look, then it will certainly be available for you. If you know a coordinator that didn't get here and you think they would really benefit from it, let them know it's going to be on the webinar. Thank you all for joining us today. We had a great time in conversation on the couch, didn't we, Dr. Chris?
Thanks very much, Elaine.
And we value wise words from you as an experienced doctor managing workplace injuries.
Happy to hear from everyone again. Thank you.
Thank you.